Hey everyone, I'm Dr. Cohen with Advanced Medical Center. I'm going to share some important information with you today regarding disease. This is disease in general, but we can apply it specifically to arthritis. With any disease, there's a beginning and an end. At the end of the disease, one of two things happens. You're cured or you die. That's how disease ends. With most conditions, we can look at cancer and heart disease as other examples. There's a beginning, there's a first half, and a second half. Where do the majority of the symptoms show up in these types of diseases, and actually any diseases? Most people think it's the first half, but in reality, it's often the second half. This can be seen with a cancer. How many of you have known someone who's had cancer, maybe a stage 4 cancer, who had no symptoms until it was too late? The same can be said of heart disease. Someone could have had heart disease for years and years and years with no symptoms. The very first symptom, which could be also the last symptom, could be the heart attack. And that could be the end of the disease. Arthritis is very much the same way. A patient may have had an injury or trauma, maybe a car accident 15 or 20 years ago, or maybe a sports injury, a knee injury from football or rugby or soccer, something like that. That injury may have healed and repaired itself to a certain extent years ago, but the arthritis that started at that time continued on. Maybe they didn't feel any pain for those 15 or 20 years, then just 6 months ago, the patient says they're feeling increased pain. They're feeling symptoms. They're getting worse. It hurts to walk. It hurts to do their daily activities. Did that disease just start 6 months ago when the symptoms showed up? Or did it start 15 or 20 years ago with the original accident, the original injury, or the trauma? When we take an x-ray and we look at that knee and we see that it's almost bone on bone, we know that it didn't start 6 months ago. A good knee doesn't lose almost all the cartilage and turn into a bad knee in 6 months. It's taken time to get to that point. Maybe there wasn't a symptom. This is why waiting until you have symptoms is a bad idea. In our clinic, we are very preventative. We want to help our patients before they have the problem and help them as soon as they do have the problem. If you wait too long, a patient may not be a good candidate for regenerative medicine. They may have to do a surgery. It may be that their only option would be a joint replacement, and we don't like that. We want to be able to help our patients before they get to that point. So keep the disease timeline in mind, and know that just because you've had symptoms for only a few months doesn't mean the problem or the disease is severe, but it also doesn't mean that the problem hasn't been going on for a long time. If you found this helpful, please share it and leave a comment. We would love to connect with you. We'll talk to you soon. Thanks and have a great day.